I want to welcome you to our can you believe we're saying sixth annual Digital Health Summer Summit. We're co-located with BIO, as you all know, and really excited to be back in San Diego, where we actually started the show. I want to introduce myself, for those of you who don't know me. My name is Jill Gilbert, and I'm the producer of our Digital Health Summer Summit at BIO and the producer of the Digital Health Summit at CES in Las Vegas in January, so hopefully you'll be able to join us there. I work with an amazing team out of Living in Digital Times, and we have a bunch of people here from there, so hopefully you'll be able to meet them. Let's talk a little bit about the show. This year's theme of Going Vertical is focused on the fast-paced climb of digital health. I actually remember first starting out when I was looking for topics, and I found it extremely challenging to find anything that wasn't based on a hypothetical situation. And it was seriously the beginning of the Wild Wild West, with a lot of hopes, a lot of dreams of what things could possibly bring to the healthcare system. And the vertical trajectory of this industry has been staggering. I can barely, seriously, I'm like exhausted from reading all of the different releases that come out. I used to try to search digital health online when I was starting this show, and now it's just flowing into my inbox. So I'm sure you guys are experiencing that as well. Now, with all of the wonderful development, that's not to say that there's not extreme challenges on the plate of every single stakeholder in both healthcare and the technology industries. So some of the biggest ones that I feel I get talked about often with me are reimbursement challenges, interoperability, EHRs, sore subject sometimes, privacy issues, how to develop a sustainable business model, regulation, updating legacy systems, which we're going to be addressing in the show, and the list honestly keeps going on, and lest I forget, utilization and engagement. So with all of this amazing growth that's been going on, this summit is not only here to showcase those advancements, but to also address the challenges. And this show was born out of our hope to help you to find ways of working together to advance your businesses. So I want to give you a quick preview of today's lineup. We kick off with the overarching theme of how I love this monitor up front, I'm not used to it, sorry. How technology is tackling our greatest healthcare challenges. We're going to look at the new era of precision medicine, obviously addressing cancer, Alzheimer's, everything. Confronting Alzheimer's and mental health issues, opioid prevention and addiction, and sleep's role in chronic disease prevention. Next is how the largest Western U.S. hospitals forging unique partnerships to solve their greatest challenges. You seriously don't want to miss this. It's like an old joke that I used to hear, what happens when a priest and a rabbi and a monk walk into a bar. But in this case, we have leadership from global consumer electronics company, a VR company, a progressive Methodist church, a digital health trailblazing company in mobile EKG and artificial intelligence, and last but not least, the largest Western U.S. hospital, Cedars-Sinai. These partnerships will inspire everyone. Moving on to a look at 3D printing and the developments that it is providing in healthcare and what we can expect on the horizon. And then, being at BIO, of course, pharma's plunge into digital health. And then a quick preview of tomorrow, just so you guys make sure you look at your agendas. We will definitely be looking at the proliferation of artificial intelligence. That includes everything from drug design and discovery to genomics. It's everywhere. It's everywhere. We're going to look at breaking into legacy systems, and we have a company who has truly really changed the landscape of blood collection. And it sounds kind of icky, but it's actually what they've done is really pretty astounding, and yet their challenges around breaking into very, very elder legacy systems has been very complicated, and so I think you'll have a lot to learn from them. We'll address the $300 billion medication adherence problem, and once again, going back to utilization. So we have a great case study of how one company is personalizing their approach to have their users have maximum engagement. We'll also have 2 sit-downs with 2 of digital health's leading technology companies, Validic and Grand Round. Another one you won't want to miss, Real Lunch in a Virtual World. 3 amazing virtual reality companies coming to share. We used to kind of think of this as gaming, and wait till you see how it's being used in the hospitals and beyond. Hot topic this year, who's dominating in digital therapeutics. 3 of today's rock stars, literally, I was so thrilled that they all agreed to be here. NeuroTrack, Click Therapeutics, and Diathera. Very, very excited for that tomorrow afternoon. And then we're ending tomorrow on what promises to be, it was a highlight. They've done this workshop once before at a analytics company, and it was definitely one of the highlights of the show, which was how to design a sticky medical device from leaders Zymedica. So, without further ado, before I introduce our keynote, I'd like to thank our sponsors: Senior Link, Zymedica, GN Hearing, ResMed, Redox, Intelligent System Sources, and RTC Magazine. Thank you. Yes, thank you.